infant death syndrome and safe sleep for infants. What is sudden infant death syndrome? Sudden infant death syndrome, or an SIDS, is the unexplainable, sudden death of an infant that is less than 1 year of age, and the cause of death is undetermined after the completion of a thorough investigation. Sudden infant death syndrome is typically seen in infants who are male, born prematurely, and those who are born of a low birth weight, typically less than 5 pounds and 8 ounces. SIDS is also seen commonly in infants from socioeconomically disadvantaged families. Some factors that contribute to the increased risk of sudden infant death syndrome include clothing, uneven bed surfaces, pacifiers, bed sharing, stuffed animals, and even car seats. So why is safe sleep important in infants, and how is it related to sudden infant death syndrome? Safe sleep helps to prevent SIDS as many times when baby is left alone in the crib to sleep, there is no direct supervision on the infant. This can cause danger to strike. An unsafe sleeping position of the infant can cause accidental suffocation or strangulation from items such as blankets or stuffed animals, as well as uneven surfaces in the bed. Sleeping in a regular-sized bed with mom and dad can also be dangerous for the infant, as they can become trapped under blankets and have improper positioning from a lack of a hard surface. In a study that was completed regarding sudden infant death syndrome, it was found that 51.9% of SIDS occurred among infants who were not sleeping on their backs, 60.1% occurred in an adult bed, and 62.7% occurred while the infant was sleeping in a surface with another person or bed sharing. So how can we prevent SIDSs? There are many ways that a parent can eliminate stress and worries about the risk of their child being a victim of sudden infant death syndrome. Some of these include having infants be placed on their backs to sleep, use a firm, flat mattress in a crib, avoid overheating the infant, avoid placing unnecessary items in the crib with the infant, including blankets, bumper pads, and stuffed animals, and infants should not be exposed to tobacco smoke before or after birth. Although we speak a lot on the importance of sudden, safe sleep in infants in order to prevent SIDS, some other factors such as smoking can play a role in the risk of SIDS. This is because the chemicals in tobacco smoke can alter the brain development of an infant and the lungs. This can cause the infant to have trouble breathing and can also be responsible for SIDS. Here's some more information. Infants who sleep on their stomach rather than their backs are 6.6 times more likely to pass of a sudden infant death syndrome than those who are placed on their backs to sleep.
Sudden infant death syndrome and the importance of health teaching. Health teaching is important because with the proper education, sudden infant death syndrome can be avoided. New mothers can benefit from this information and use interventions to prevent this from occurring. Health teaching and education can also help with a mother who is coping. This way there is a better understanding as to what and why this has happened. Families who have suffered from sudden infant death syndrome can be educated about coping mechanisms such as support groups, family support, and/or counseling.
Sudden infant death syndrome can happen without any explanation, which makes it difficult to assess. The physician would assess any predisposing factors that could contribute with sudden infant death syndrome and assess for any other possible health complications that could have occurred. Nurses would assess any family history of sudden infant death syndrome. They would also assess the mother's age. As of before the age of 20, babies are at higher risk, the mother's smoking habits, drug use or alcohol use during pregnancy, prenatal care, the birth weight of the infant, as premature babies are at greater risk for sudden infant death syndrome. Nurses would also assess the sleeping environment, the respiratory system for any abnormalities in breathing or difficulties breathing, and any abnormal limb movements and cyanosis.
Safe sleeping for infants include the baby has his own sleeping area and is not sleeping in the same bed, but sleeping in the same room for at least the first 6 months. This allows for you to be able to hear them and check on them more often. Having the baby sleep on his or her back instead of their side or stomach. This is to prevent the fact that when babies sleep on their stomach, it puts pressure on their diaphragm, making it harder for the baby to breathe. Also ensure that a firm mattress and no loose blankets, pillows, or stuffed animals are in the crib with the baby. This will help to remove the chance of suffocation. Make sure that the infant is not too hot. Keep the baby warm, but make sure that they do not get too warm. You can do this by having them sleep in proper sleep clothing and not having them sleep with blankets or heavy clothing. Smoking around the infants also puts them at a higher risk for SIDS. Nursing interventions for a grieving parent who has just lost a child to SIDS. Offer the parent emotional support and proper information in order to find groups and other people that they can talk to after their loss of a child to SIDS. Inform the parents that the mandatory police investigation is standard for any child that dies from SIDS. Allow the family time to heal while still being there for them. Encourage them to talk and share their feelings and remind them that they are not alone. When talking with a parent who has just lost a child from SIDS, be simple, be honest, and be comforting. And don't forget about the father. The father has gone through just as much as the mother, and you need to make sure that their feelings are met and that they get the proper support that they need as well. Some things that you should never say when talking with a grieving parent is, "You'll get over it in time, it's for the best, you can always have another baby, and count your blessings." This is important to not say when talking with a grieving parent, as the parent is not looking for the bright side at the moment. They are looking for someone to be there and validate their feelings and support them in any way that they need.
So now let's look at an example of a case study that can be related to SIDS. Mark and Rebecca are a young couple who have recently became first-time parents to their son Mason, who is now 1 month old. Rebecca is a regular tobacco user, and although she quit during her pregnancy with Mason, she has recently started to smoke again and smokes with him in the car with the windows rolled down. Mark has also recently lost his job, and Rebecca is off for maternity leave. This has caused them to try and save money where they can and led them to sell Mason's crib. Mason typically sleeps in bed with Mark and Rebecca and has been doing so for about the past week. What are some factors that are putting Mason at risk of getting an SIDS? And what can be done to lessen the chances of an SIDS? In Mark and Rebecca's situation, there are many factors that can contribute to the chance of Mason being a victim of an SIDS. One of these factors include Rebecca's smoking habits. Although Rebecca opens the windows when she smokes with Mason in the car and didn't smoke throughout her entire pregnancy, she can still cause damage to Mason's respiratory system through secondhand smoke. Also, it states that Mark has recently lost his job and that there may not be as much money coming in as there once was. This may put them in a socio-economical disadvantaged situation. Lastly, Mason is sleeping in an adult bed with his parents, where he can possibly have the risk of suffocation as there are heavy blankets on the bed which may trap Mason. As well as on an adult bed, he doesn't have the support that he needs as he would in a crib with a hard, flat mattress. So that is all that we have for sudden infant death syndrome and safe sleep for infants. We hope that this presentation has helped to teach you about what an SIDS is, the importance of safe sleep, the ways to decrease the risk of an SIDS in an infant, and some assessments and health teaching which nurses and doctors can provide you with. Thank you.